One of the most common procedures sought after women, particularly after pregnancy, is what is commonly termed as a tummy tuck, or we call it an abdominoplasty. That's where you have the excess amount of fat, the hanging. The patient may even have a scar like in this patient. When we look at the illustrations, we see the amount of skin and fat that needs to be removed. It is then subsequently the belly button is released, the excess amount of skin and fat is pulled towards the pubic region. Then it is excised or removed completely. Then the other part of this procedure, which is very important, is the muscle repair. With pregnancy and being overweight, those muscles have split and they need to be repaired. By repairing those muscles, we tighten the abdominal wall. So it's not just the excess amount of skin and fat that needs to be removed, but you need to tighten the abdominal wall, and eventually the patient is left with a scar in the lower area, as low as I can possibly make it, and in the belly button region. These are very, very typical examples. Sometimes, as in this case, the patient also desires liposuction. So liposuction of the hips and the flank region are performed in conjunction with this procedure in order to give the patient a more stylized waist. And you can see from the before and afters where she's gotten a significant result. It is very important that patients who undergo these procedures take care of themselves following the surgery. If the patient does not take care of themselves, then the surgery is a waste of time because they will gain weight again. In this patient, interestingly enough, she's not really overweight, but what she was mainly concerned about were the stretch marks. And this is a very effective procedure in removing the stretch marks that are located between the belly button and the pubic region. This again is a procedure that can be done either as an inpatient or an outpatient procedure. Most of the time these patients are done as an outpatient procedure and they're able to go home to be followed up in the office. Patient usually needs 2 weeks to recover, and then they're back to driving and back to work as long as the work does not require any physical or strenuous activity.